Hello and welcome to the EduTalk series hosted by Biotone Edu Partner Program, and massage industry experts. With the challenges continuing to face massage schools, students, and practicing therapists, thanks to COVID and now the variants, the EduTalk series hosted by Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Irene Diamond, developer of active myofascial therapy, the Diamond method, a biopsychosocial approach providing clients effective and efficient results. She's an international pain reliever and mover improver for bodies and businesses, helping professionals not only treat clients, but develop thriving practices to attract affluent, appreciative clients who pay, stay, and refer. Her pain relief and wellness center in San Francisco was San Francisco's first, and now operates nationally as Precise Private Practice. Let's listen and learn as Irene introduces active myofascial therapy, explaining how the Diamond method provides long-lasting neck and shoulder pain relief in only 15-minute sessions. The magic is the inside-out approach, where clients actively move their joints while receiving manual compression. The client-partnered treatment is effective and efficient, plus easy on the therapist. Before I turn it over to Irene, please be sure your video and your sound is off. And with that, welcome, Irene.
Hello.
One more video here to turn off.
Welcome,
Irene. Thank you for joining us. And I will go ahead and turn the evening over to you. We're looking forward to learning more about the Diamond method. Thanks.
Great. Thank you so much for having me, Donnell. It's great to be here. It's perfect timing. The Diamond method. I just wrapped up 3 days in San Francisco, held at my wellness center, teaching providers who flew in from all over the country to learn the Diamond method. It's a 40-hour certification course. So this snippet is coming directly from that, or people have invested a whole lot of time and a whole lot of money to learn it to bring back to their practices. This is going to help those of you watching. Literally, I know it's a bold claim, and I'll get into my slides in a minute, but this is a bold claim stating that what you learn in this next 20 to 30 minutes, if I can keep it short and sweet, will literally or could literally transform your practice, because you will be able to learn active techniques where your clients are active, and that will change the paradigm. We call it the inside out approach. What you learn, you can apply literally today or tomorrow. So it's not something that you need to spend a whole lot of time practicing, although obviously it's going to be better if you do. But I've had therapists who've learned it, applied it when they got home on their partner or their friend, and were able to get amazing results right off the bat. So it really is something that I don't want to hype up too much, but I think you'll agree once you get into the material how effective it is. So I do have some slides. I'm going to kind of be switching back and forth from my slides to video so you can see, so we can do some demonstrations here. I want you to play along. Hopefully you're sitting in a place and not just listening in the car. Hopefully you're sitting in a place where you can see the slides and then also participate. So I'm going to switch right now and share my screen. There we go. Please let me know if you cannot see my screen, but I'm assuming you can if I don't hear otherwise. So simple neck pain relief through active myofascial therapy, the Diamond method. And I'll give you a little caveat. what we are knowing about science right now and fascia. Some studies are showing that we cannot mechanically affect fascia. We can't change the length, we can't soften it, we can't do all the stuff we thought we could do. The name active myofascial therapy has been a name I've used in this method for 25, 30 years. So we're transitioning to change the name to active modulation therapy. Modulation because we're modulating people's pain, we're modulating their movement, we're improving their ability to function. So we're making change. Modulation means change. So for now, myofascial, also it's a marketing word that people actually know. They'll go and they'll Google myofascial. So we're leaving the name for now, but just recognize it probably will have a different name. Active modulation therapy, the Diamond method. So this is for manual health and wellness providers, anybody who works with their hands, with their client. This is going to be something that I believe you will really be able to apply. It provides long-lasting neck and shoulder pain relief in only 15 minutes. Literally a few minutes of this, you can find relief that you would possibly take an hour, if not longer, in your massage practice or your manual therapy practice where the client is passive. You'll be able to get these results literally in 10 to 15 minutes. The magic is in the inside out approach. The client is active, their brain is active, they're participating. We now know that pain relief, again, science supports pain relief comes from the brain sending the signals based on our mechanical manual touch and based on their thoughts and based on all these other components. So this work works so fast because of the inside out approach. We're going to be working on necks. Of course, this applies to people's entire body, but the client actively moves their neck or their shoulders while receiving the manual compression. And I'll demonstrate and you'll get to practice it. And therapists really love this because it's client partnered. It's an effective treatment and it's easy to learn and it does not require you breaking a sweat. So how did I become the neck expert? How did I start the therapy? It was based on my own need to relieve my own neck pain. Why? Because I did what your mom told you to not do, which was be careful. You're going to break your neck. Guess what? I broke my neck. I used to be an acrobat. I was doing gymnastics, standing on a guy's shoulders, fell forward, landed on my head, ended up with a spinal cord injury, compression fracture of my 5th and 6th cervical vertebra. And I was in the hospital for 2 months. You see here, I have a picture of me in a halo. When I was 15 years old, those 2 screws screwed into the front of my skull and 2 screws in the back, holding that thing in place, which provided traction to try to create holding my spine aligned. I also had a weight belt around my waist to pull me the opposite direction. So literally I was in a stretching machine for 2 months. I was like that. It was quite the experience. But as they say, what doesn't kill you makes you stronger. And it gave me an understanding of my own rehab process, plus what neck pain really feels like, migraines, that kind of thing. Nobody at the time, this was, quite a long time ago, 40, well, I don't know how many years ago, a long time ago, physical therapy was different. And I had to do my own rehab. So fast forward, I now specialize in neck and migraine relief. And you will too after this. This is perfect for your clients. Within a 15-minute treatment, you will be able to relieve your client's neck pain. Now, does that mean it'll go away forever after a 15-minute treatment? Possibly, but it might take more than 1 or 2 sessions. And the bonus is it can also possibly relieve migraines and arm pain as well. Achieve or relieve, what kind of clinical outcomes? So here's whenever you work with me, I'm going to stop the share for a sec because I want you to do this with me. Like I said, it's participatory. So I'm going to stop the share. Can you see me? I want you to put your hands out like this. Now, anytime a client comes to you, whether it's neck pain or they want to run a marathon or they're pregnant and they want to have an easy labor and delivery, People come to you because they either want to achieve a goal or relieve a problem. Do that again, achieve a goal or relieve a problem. Now, you probably already also know I'm a business coach. So when I work with clinic owners across the globe, we focus on when a client calls you, they call you, they raise their hand, they walk in, they email you, they text you, they reach out and say, hey, I would love to speak with you about hiring you or about booking an appointment. It's only for two reasons. They want to achieve something or relieve something. So keep that in mind when you have a client who reaches out to you. In this case, they're reaching out because they want to relieve their neck pain, or they want to relieve their stiffness, or they want to achieve better mobility. So if you are a manual therapist or if you are a massage therapist, one of the things I encourage you or invite you to do is to think about, are they booking an appointment with you because they want a massage, or are they booking an appointment with you because they want to relieve their neck and shoulder pain? Probably because they want to relieve their neck and shoulder pain, and they think the best way to do it is through massage, or through manual therapy, or through cupping, or through Reiki, or through trigger point therapy, or neuromuscular, whatever the modality is. And I'm going to invite you to switch the paradigm, flip the paradigm, think about they are coming to you for relief. They don't really care the mechanisms or the modality behind it. Obviously, if needles are involved or surgery is involved, that's a different story. But depending on what modality you're trained in with your hands, they're not coming to you for that. They're coming to you for the end result. So as a business coach, I always talk about selling the end result. And in this case, it is no different. So I believe I'm making a bold claim that this really is the best method. So fast relief benefits for them and for you. Fast relief is thrilled clients. They come in, you get rid of their neck pain in a short time, they're off and back to work and living their life. It can be done in a clinic, in your clinic, in their home, or in your office. You can come to this person's desk and sit behind them, or have them come away from their desk and turn their chair so they're sitting and you're able to stand behind them. You can do it anywhere. The client stays clothed. Now, and this woman, for example, I'd have her take off her jacket, but she could just keep her shirt on. So it's super easy. And here's the benefit of the Diamond method is you charge for results, not for time. You charge for results, not for time. It's a big thing that I suggest you look at considering doing. And again, how much is a client's pain relief worth to them? So if you can relieve their neck pain in 15 minutes, if your 15-minute session is typically $20, well, guess what? You could probably charge a whole lot more to relieve their pain. And oh, by the way, it'll take about 15 or 20 minutes. If you need help on that, let me know. That's what I specialize in. So the difference between the Diamond method and typical therapy sessions is that this is not passive. This is the inside out approach versus an outside in approach. When you look at these two images, you see the hands on the body. The therapist is doing something to the client. The client is relaxing, they're enjoying, they're zoning out, they're thinking about how wonderful it feels. The therapist is doing the work. With the Diamond method, the client is the active participant. They are doing the work. The therapist obviously is doing the clinical thinking, the critical thinking, the applying the manual external forces to their bodies, but the client is doing the active work. So as I mentioned, today's presentation comes from the full active modulation therapy, the Diamond method 40-hour course. Let's jump into the actual, how do you do it? Because I know that's part of what's important. Don't piss them off. Don't piss them off. If a client wants massage, but you want to try to incorporate AMT, ask them first if rather than zoning out, they're willing to be an active participant. You need to do that, because otherwise, if they come in thinking they're going to just fall asleep on your table and you start having them move, or do something, they're probably not going to like it too much because that's not what they were expecting. And I learned this the hard way. I write this in my book about, it's called Design Your Dream Practice. And I talk about Grumpy Joe. Grumpy Joe, I learned at the very beginning when I was working on this method. I said, hey, Joe, I've got this method I think would be really great for your back pain. And he's like, tell me about it. And I told him about it. And it was that he was going to have to move and I was going to press on some points. And he had been coming to me twice a week forever. And it was super hard, deep tissue massage therapy. And I wanted to try this because it's so much easier. And Grumpy Joe looked at me and said, Diamond, I don't pay you to make me work. And I learned right then and there, not everybody's a candidate for active myofascial therapy. So I invite you to ask your clients first, hey, I've learned this new method. I'd love to try it. And are you willing to be an active participant? And 9 times out of 10, if you have a good relationship with them, they will say yes. Every now and then you'll get a Grumpy Joe who says no. So the client is seated on a stool or a chair without arms. This obviously can be done on the table as well. However, for today, we're going to do it seated. The therapist stands behind them or beside them. Now, here's the thing. In the Diamond method, we have a 7-step approach. It's literally DIAMOND is how we follow the 7 steps. The A in the Diamond is activate the area with actions. So I'm going to stop my share of my screen. And I would love to, I didn't ask Donnell if this is possible. Going to take a risk, Donnell. Is it okay if we turn on everybody's camera? If you're not driving, I want to have you do this with me. You're going to sit up tall in the chair. We're activating the area with actions. This is what I'm going to have your clients do as well. So if you're feeling up for it, go ahead and turn on your camera. And what we do is we put our hands on our belly and we literally lift our shoulders. Thank you, Tanya. I see you. Hello. Perfect. Lift your shoulders up. And then roll your shoulders back, squeezing between your shoulder blades and then pushing down. We call this shoulder circles in AMT. Hands are on your belly because it isolates the movement. So lift your shoulders up as high as you can, roll them back as far as you can, and push down as far as you can. In the Diamond method, we have a phrase, the greater the contraction, the greater the relaxation. So you can make baby circles. Okay, that's good. But the bigger, the better. So when you have your clients do that, really have them maximally contract up, squeezing it back and pushing down. Why do we do that? It helps release the contractions and the spasming. If there's anything there, it already brings blood to the area and it starts to the relief process. Should feel pretty good, right? I see some familiar faces. It's wonderful to see you all. Thank you for being here. All right, so that's activating the shoulders. You can do a simple neck to head to shoulder. You could use your hands, you could add a little bit, but remember, if your hands are doing the work, that becomes passive for your neck. So that's a stretch for lateral. Obviously, you're going to probably want to do both sides. Now, I'm all about assessing as we're treating. So as you're doing this, with your clients, you're watching and seeing where their range of motion might be different, right to left, front to back, that kind of thing. And then we have rotation. So we did shoulder circles. That's one of the actions. The other action is called the turtle. So if you're sitting up really tall, I'd love you to do this with me. You're going to bring your nose straight to your computer screen as far as it'll go. Thank you for doing this. I know it looks silly. And slide all the way back. Notice we're not tipping our head up. We're staying straight. Go all the way forward. If you feel any pull, pain, or pinch, you want to if your client feels any pull, pain, or pinch, you're going to want to have them let you know, because that'll give you information. This is called the turtle, activating the neck muscles, and finish in the back of the turtle stretch. Okay, so those are 2 actions that start the process of relieving neck and shoulder pain. It's passive. It's wonderful. It's active. I'm sorry. It's not passive. So they're being involved. They're doing the movement. They're starting to notice and aware what's going on in their bodies. It really makes a comprehensive change in the outcome of the session versus you moving them and taking them through these ranges. All right. Thank you for that. I am going to share my screen again. You can go ahead and turn off your video. Perfect. Okay. So we did the shoulder circles. We did the turtle. Now you're going to stand behind your client and you're going to palpate to locate the tender spots in the neck and the upper shoulders. We call this hot spots. Hot spots. And if you're enjoying this and finding good feedback on this, that would be terrific. I'd love to have you post in the comments any ahas. That would be helpful. So we palpate, we feel around, we see what's going on, and we find areas that might be tender, might be sensitive. They might go, whoa, that's something. We call it a hot spot. You'd feel around behind in the traps and the neck muscles, anywhere that you can access, again, depending on what your goal of the session is. Then we do what we call the trap squeeze. It's a pin and, capital T, it's a pin and stretch movement. This is from a training that we did the beginning of the year, of course, COVID and covering and all that good stuff. So you literally hold the trap, the client is sitting, and then as you're holding and squeezing, you keep your fingers still, and the client tips their head to the opposite side. So you do that lateral stretch. If you want to practice it right now, watching, reach across, grab your own upper trap and hold, and as you lower your head to the opposite side, ear to shoulder, not shoulder to ear, ear to shoulder. So it's a pin and a stretch, but the client is actively doing that. Your hot spot release now, you can use a tool or you can use your fingers. Most people use fingers or thumbs. Now you're going to press into the tool, into the hot spots. Usually, if you're not sure where to go, I suggest you just start with C2 transverse process. The TP, where the second cervical vertebra is, where the levator attaches, is usually for most people very involved. So if you don't even know where to start, that would be a good place to start after you did the pin and stretch to the upper traps. Again, I'm not giving you a protocol. I'm giving you the ingredients for you to then take and make your own wonderful, yummy dinner. I'm just throwing out the tomatoes and the cheese and the and the pasta. So you're going to press into a hot spot. You're going to hold the spot and then have them move their head or shoulder. So notice where they're holding on a spot on her neck. She would gently shake her head no, or she would shake her head yes, while that pressure is being maintained. You could work up and down the neck. You could work into the suboccipitals. You can work anywhere, obviously, that you can reach that's convenient for you and for them in this seated position. I like working with people seated because that's how gravity is affecting most of us. Most of us don't hang around laying down all the time. So when they're seated, you can observe how their body reacts to the gravitational pulls. And you can also guide them easier from a seated position with them closed if you're accessing areas like the neck and shoulders. After you've worked the neck, then you finish by activating the area with actions again. And the purpose is to integrate it. So their brain starts to recognize, ooh, I feel better. I feel less tension. The pain is dissipated, hopefully by then, and maybe they have better range of motion, greater range of motion, but greater ease of motion. So very cool. How do we finish? By activating the area with actions. We do that with the same shoulder circles and the turtle. So how did that go? How do you feel? That's 15-minute treatment for neck and shoulder pain relief. Thank you very much. I hope that was helpful for you. Even possibly gave you some pain relief. What do you think, Donnell?
I was right here along with you doing it, except no one was standing behind me to get my hot spots. But I definitely see the value and the benefit, and you're creating a new muscle memory for your neck. So it all sounds good. Anything to stay in a state of well-being. All right. Now I've had a request that I need to allow video, so I'll remember that in the future. What kind of tools are acceptable to use for the hotspot?
Well, there's a lot of tools out there. Just, I've been doing this for 30 years. So sometimes your thumbs and fingers get a little tired. So, there's all sorts of little manual things you can hold. Here's my little tip on holding a tool. What people end up doing sometimes is they'll use it, but then their wrist gets kind of torqued. So keeping your wrist neutral is always going to be the most effective if you are pressing in with a tool. And again, it's just a personal preference. So I don't endorse one over the other.
Now, I mean, these are 15-minute sessions. Is it a series of 15-minute sessions? Or one session and they're good, and the next time their neck is wacky, or they're back to see you? Does this empower them to do the techniques you showed, like the turtle at home?
Yeah.
So how does it work in the real world?
Well, in the real world, totally good results, even if it's simply or just a 15-minute session. Somebody's had chronic pain for years and years. Obviously, a 15-minute session might not resolve it completely. So we look at what the causes are. I'm all about relieving or changing or reducing or eliminating the cause of the neck problem in the first place, not just symptom relief. So symptom relief is fine, but that's temporary, and that's why the client comes back again and again and again. That chronic problem in their neck, in their shoulder blade, where everybody says, oh, that knot's back. Well, why is that knot back? It's because it wasn't addressed comprehensively of what's bringing it back or what's the cause of it. So in the Diamond method, we look at, the biomechanics and the function and all the strength and stability. We consider it a three-legged stool. So one leg of the stool is releasing and stretching what might be tight or short. The other leg of the stool is strengthening and stabilizing what might be weak or unstable. The third is the re-education part, the programmatic memory, the muscle memory, as you mentioned. And then what sits on top is self-efficacy, building self-efficacy, building confidence, building their awareness of what's going on. We say, like 90% of the change comes from them going, oh, wow, I wasn't able to move my shoulder that big, but now look how big I can do it. So they start having a whole lot of confidence, and absolutely we encourage them to do the shoulder circles and the turtle throughout their day. As soon as they notice they're like this over their computer, sit on straight, hands on your belly, lift your shoulders, do a big shoulder circle, do the turtle forward and back, finish in the back of the turtle, and then go about your day. And if you notice you're here again, guess what? It's time to do it again.
Very good. How does charging for the result work in a schedule-based practice?
Well, that's a big question for a few minutes, so I don't have time to get into that. I'll defer on that question, but it's totally possible.
Okay. You don't have 3 other 15-minute. I'm just teasing. So you could keep them busy an hour. There is no.
Pardon me, let me answer by saying, in my practice, I don't charge by time. I mean, you have to have a time element because you have to schedule and people have to know, you know, how long the babysitter is going to be there or how much money to put in the meter. So there's that element, but it's not like, oh, come in for 15 minutes. 15 minutes is $50. That's not the way to do it.
All right. And it could be blended in with a massage as well.
Absolutely.
So active and passive.
Absolutely. Let's do this seated on your neck, and then we can get you on the table and do your massage.
Great.
Absolutely.
Now, we do not offer continuing education credits for EduTalks. If they want to learn more about continuing education credits from you directly, they can find that on your website, irenediamond.com. Is that correct?
Yep, that's the main website. They can absolutely go there. They can also send an email to team@irenediamond.com. Team, TEAM @irenediamond.com.
And I think we answered this question. Isabella was wondering if it's offered as part of a massage while the client is laying down, minus the turtle. And yes, it sounds like very complimentary.
But not minus the turtle. We do the supine.
Well, not if they're on the table.
We do turtle supine because then you have more gravity. It's
okay.
In a true AMT session, seated on the table, prone, supine, sideline. We do all these movements everywhere. Everywhere, all the different positions. And then that gets into positional awareness. How do they know, you know, where up is when they're face down on the table? It's real fun. It's re-educating their body movement patterns and how they move in space. It's fun. It's fun.
And effective. I wanted to go back to the tool for a minute because you held up a pen. You're not actually suggesting they use a pen. They're either using their hands or their thumbs and knuckles. Okay.
Yeah, anything but there are wooden tools, you know, rubber tools, things that people can buy to use to stabilize if they want to or need to.
All right. Well, I don't see any more chats coming in. And if they do in the next, few minutes, we'll address those as well. I wanted to mention to our audience that you will be presenting in 2022 an EduTalk on attracting affluent, appreciative clients. So, please join us in 2022 when Irene speaks on that topic. And in wrapping up, Irene, is there anything else you would like to add on how people can contact you or, a question came in. Is your 40-hour certification program for the whole body or mainly the neck area?
It's for the entire body. And it basically just sort of in a nutshell, it'll address pretty much every single orthopedic condition, symptom, concern that people have. So shin splints, sciatica, frozen shoulder, migraines is not orthopedic, but it covers that as well. Because if it's coming from what we assume is trigger point referred to the head. If it's a hormonal migraine, it's not going to do anything for that. But even fibromyalgia, I've had amazing results with people who've not been able to function, and we've been able to get them more functional. Again, why? Because it's the three-legged stool. So as much as I love manual therapy, massage, and other types of mechanical therapy that use people's hands, what we found is that's one portion of it, because oftentimes people's pain is because possibly muscles are overstretched and weak. For example, the thoracic region is really common. Most people are forward hunching with a forward head and neck and extension. So there's muscles that could be stronger. There's other muscles that need to be lengthened. There's other muscles that are already long enough, but we just need to take the tension out of it because that's causing pain. And then we need to re-educate them so they know how to move. So they're not they're not reaching for their pen, but their shoulder goes up. They need to be able to reach for their pen with their shoulder staying stable. So a lot of the time, whether it's an ankle stability or knee or a hip stability or a shoulder stability issue, when we can address all of that, that's where the comprehensive results come. So the 40-hour training goes into all of that. There's an online component. Years ago, it used to be taught over a 5-day structure, and then it's hard for people to be away for 5 days, and it's expensive to stay in hotels and all that. So I started way back when the internet was starting. We put about 15 hours of the pre-work, the theory and the concepts, all online, so people could see it. And as soon as they enroll in the training, even if they're not coming in person, they get that access to the online component where they can literally learn what they need to learn and start doing it. Now, they're not certified or anything, but they can still start applying it right away because they can see the concepts, they can watch videos, they can listen to audios. And because I'm a business coach as well, I throw in marketing because I can't help myself. And people need to know how to take this approach and actually, get clients on the table or get clients in the chair. They can be fabulous with what they do with a client, but getting the client oftentimes is a big struggle as well. So they get a little bit of the marketing as well.
Well, that sounds like a perfect segue into the gift that you're offering to our attendees tonight and RSVP folks. Do you want to mention a little bit about that? How they go about receiving that?
Well, yeah, I'm happy to. So I do have the business coaching and I do the AMT training usually twice a year. I do have a new educator who's going to come on next year and also start teaching the Diamond method, which is I'm really excited about. We keep our classes small. I'm all about bespoke, hand-tailored clinical treatment as well as educating. So this is like the bigger classes that I do is here at other conferences. I like to be one-on-one with people or in small groups. So if you enroll in next year's the Diamond method training, again, 6 or 8 people in a class held at my wellness center, super small, like we're shoulder to shoulder. I get my hands on you, you get to feel it. You practice right there. Mention this Biotone educational series and you'll get a special discount bonus on that. And then also I have how to attract the affluent appreciative clients. And there's a link. I think, Donnell, you're going to be sending that link out to people. So,
I will. It will be in the follow-up email with this recording link.
Perfect.
And contact.
Yeah. And then also irenediamond.com/schedule should bring you, if you're serious about wanting some business coaching help. I don't accept everybody because, again, I want people who are mover shakers, not just dragging their feet. So if you really want to take your practice and catapult it in an ethical, responsible way, the concept is called a precise private practice. And you handpick the clients you want to work with. You don't need to be open to the public. You can, but if you choose to be a precise private practice, I'm the person who can help you get there. You offer a 100% guarantee on the work you do. Huh? How do you do that? It's possible. I do. It allows you to charge higher fees because there's no risk. So you really pre-screen who you're taking in. You offer a guarantee. Your fees are supportive of your lifestyle, your business, that kind of thing. You can always donate your services, your time, like I'm doing here. I'm donating my time. So you can handpick how you want to work with people. But if you want some help on that, reach out. You can do irenediamond.com/schedule, and that'll bring you to a page where you can schedule a chat with me. It's not a sales call. It's a let's talk and see if we're a good fit together. And then we can go from there.
Well, that sounds excellent. And thank you, everyone, for attending tonight. And before we go, it's hard to believe it's the end of October. We've got 4 EduTalks left in 2021. And November 9th, Sandy Fritz will present career pathways. November 23rd, Felicia Brown will present red flags, warning signals for inappropriate clients. December 7th, Drew Freeman will present Demystifying the World of Kinesiotaping. And we end the year with Sandy Dirks and Enid Whitaker on how trigger points plus stretch plus corrective exercise equal reduced muscle pain and tension. And keep an eye in your in-basket for invitations to upcoming EduTalks and join us again. Thank you so much. You'll receive a follow-up email again with the recording link, the link to Irene's offer, and also a schedule of the remaining talks for the end of the year. Thank you so much. Be safe, everyone. Stay dry if you're on either coast, and join us again. Thank you, Irene.
You're
Take
welcome.
care.
Thank you for the invitation.
Okay, take care.